Good afternoon and good morning to whoever is joining us from the United States. First of all, I am Rima Yadi. I'm president and founder of the Euro-Mediterranean Economists Association, and I am the co-founder of the Brain Capital Alliance and Brain Economy Hub. So it's a big pleasure for us to welcome you to this conversation devoted to one of the greatest challenges that we have nowadays, but also opportunities, which is the brain. We've been working for many years now with many colleagues working on a brain-based economy, which will lead us to or walk us into all the global challenges we are living in today. So let me start with some numbers, which were in fact published by the World Health Organizations in their last report. Practically, they're saying that over 1 billion people living with mental health conditions, which means that this is what the data, at least available data, is telling us. And this reminds us that 1 billion people worldwide now live with serious mental conditions. And it's important to ensure these data do not remain in terms of data, but then action is taken forward. In fact, these mental or brain conditions have become the second leading cause of long-term disability, according to this World Health Organization report. And the economic cost, for example, of anxiety or depression, which are also important conditions, they exceed alone 1 trillion every year in lost productivity. So this is also important to connect what would be the impact of disabilities and mental health conditions on lost or potential lost productivity. Yet on average, countries, they allocate only 2% of their of health budgets to mental health, which is in fact a huge gap because we need to, in reality, invest and would change our way of thinking of mental conditions and mental or brain as considering brain as an asset in which we invest over the life cycle. So if we look at the case of Spain, I think it reflects both the urgency and also a promise to this global picture. So if we look again at the data, we can see clearly that 5.8% of adults have chronic anxiety, for example, 5.3% with diagnosed depression, with much higher prevalence, for example, among women. And I quote again the World Health Organization report, and obviously the unemployed. So this is also important to keep in mind. So in reality, some surveys clearly show that 1 in 7 people in Spain have experienced depression symptoms in the past 2 weeks, for example, and about 1/3 of the population reports some form of mental health difficulties, including, again, aspects related to mental health conditions, which is clearly there shown in data, without really talking about more complex mental disorders and illnesses in terms of this population. So in reality, if we look at what Spain has done in response to these challenges, they have really allocated more than 100 million euros and 44 targeted measures in their mental health action plan 22-24, which is kind of transforming this landscape. But at the same time, the brain plan of Spain, which has been approved from 25 to 35, is leading the way in putting brain in the center of the economy, and our colleagues today, Mara, will talk about it on where are we going with the brain plan for Spain. This, in fact, if we look at the plan, which is published already, it goes beyond healthcare. It envisions a society that protects, nurtures, and invests in this very important, valuable asset, which is the human brain. So we go from the cost thinking into an investment thinking, and this is a great transformation to build the brain economy. And this is what we've been working on with Harris Ayer and other colleagues on to transform the thinking of brain health into from in fact a cost to an opportunity and to an investment, in fact. So on the brain plan of Spain, we will listen to it later on, and I am quite happy to announce also that Euro-Mediterranean Economists Association, which is also serving as a founding pathfinder in the World Economic Forum Brain Economy Action Forum, and also has been one of the co-founders of the Brain Capital Alliance and Brain Economy Hub. And also we've been working on the Global Brain Capital Dashboard, which is freely accessible to check all the data worldwide. And we are currently really working on more economic matrix to ensure that brain-based economy is not a fiction, is a reality. So in fact, what our ambition is to translate this global thinking on brain economy and brain capital into local realities, and to connect, in fact, the ambitions that we've been spearheading together with the team, together with Harris in the United Nations, the European Union, and also the World Health Organization, with really landing it to realities, not only in Spain, but also in other countries, broader in the Mediterranean, and hopefully in Africa within the G20 that is happening this year in South Africa. So the Spanish Brain Plan is ambitious. It's a model, in fact, how science, also solidarity and policy can converge to serve people, and how we can invest in people, also in the brain health of people. And this is not anymore a luxury. This is not giving to pockets of the populations, but really it is the most strategic investment a nation can do for its own future. And I am very pleased really to host today this webinar to discuss exactly how through the brain plans, for example, in the case of Spain, we can transform our economies into brain positive economy. And these are words quoted from Harris, moving from a brain negative economy to a brain positive economy. So without further ado, I would like to invite directly Harris Ayer. Hi, Harris. He has been leading the brain movement. He's senior fellow at the Rice University. We're very happy also to have Harris as member of the advisory board of EMEA. And currently, Harris has great news to share with us that we have the Brain Institute already up and running. And I'm so glad to hear this. So I don't want to talk more. So please, Harris, great to see you. And the floor is all yours.
Well, thank you so much, Rim. Thank you to all the co-panelists and to Spain writ large for this very creative plan and ambition that you have. Yesterday was wonderful. Rice University, we launched the Rice Brain Institute. I will be co-leading the Brain in Society initiative with Simon Fisher-Baum, who's going to be speaking shortly. Maybe I don't want to steal the thunder of Simon. I'll let Simon articulate more about what the Rice Brain Institute is. I think it's a very unique structure, and so anyway, Simon, I'll give that to you to share with everyone. But it demonstrates again, as part of my presentation, is moving from ideas to action. We've been talking about the brain economy in a theoretical perspective for, since 5 years ago, and now things are really moving in towards institutionalization, much more size and scale of our projects. And so that's what I want to share with you this morning to frame. I want to frame things globally, so that in Spain, that there are models out there to learn from. You'll do unique things in Spain, given the assets and resources that you have, but you do have friends, around the world, including David Gow will be speaking soon about Houston, Texas, which has a wonderful plan, perhaps the most advanced. It is the most advanced plan so far around the brain economy. And of course, Pawal Swoboda will talk a little bit about our G7 engagements as well. So without further ado, let me bring listeners into the brain economy and some of the dynamics. It is a new thing. It is something that we have been developing in the last 5 years, and developing into a robust economic transition, something like the energy transition or the nature positive economic transition or the climate economic transition. Think of those as analogs with the brain economy transition. The brain economy transition recognizes that the current economic model and societal situation is brain negative. By that we mean that the cost of mental and neurological disorders is extremely high, and it's rising. It's 3.5 trillion to the global economy in cost, and it's rising at 3% a year, that cost. So something has to change. At the same time, at a global level, we see that rates of literacy and numeracy are either stagnant or declining. That's data from the OECD. So again, brain health is challenged, and brain skills are obviously challenged. And this is as we head into a future of work that is much more cognitively and non-cognitively intense, with artificial intelligence, with rapid accelerations in either globalization or deglobalization or geopolitical or geoeconomic fluctuations. So the world of the future is very cognitively and non-cognitively, very brain intense. So we must meet that moment. That means that we need systems change. We need to think about how do we change our exposures in our lives, our industries and economies from brain negative to brain positive. What are we doing about food systems? What are we doing about education systems, about health systems, about environment, about the internet? These things we must think through. We must make neuroscience in the engine room of the way we think about the way that economies should function. So for the neuroscientists out there, what is neuroscience-inspired statecraft, neuroscience-inspired policy? That's what the brain economy is about. Yes, it's an economic transition, and I can share papers with you about the technical components, but it's also a movement. It's meant to be optimistic and hopeful, frames the brain as an asset. Brain capital should be as important as road and bridge infrastructure to political leaders. It should be as important as GDP. And so an article was written this year by a wonderful journalist describing the brain economy as a new thing. The idea that communities, societies, and countries contribute to economic growth and stability through their collective brain power. And this brain economy work will become much more visible in the coming months. There is a major report that the World Economic Forum will release in the Congress Center at the next WEF annual meeting. It's in Davos, Switzerland in January. And so it's the time is now, and we're working really hard on taxonomy definitions and making sure that we have tools and frames that can be used around the world. To boil it down a little bit more for folks, determined by the World Economic Forum and the McKinsey Health Institute, with many of us involved, there are 5 core levers to advance the brain economy or build brain capital. Safeguard brain health is the first, which means looking at health and public health interventions. Fostering brain skills, looking at education and workforce upskilling, reskilling considerations. Creativity, analytical thinking are key brain skills. Study, looking at research components, is very important, and I think Simon Fisher-Baum will touch on this quite a lot. Investing is important. How do we unlock some of the trillions of dollars of private capital that are on the sidelines of the economy, how do we get that money channeled into brain investing? How do we get sovereign wealth funds, pension funds engaged? And I think Pawal Swoboda will talk about some of the work that we've been doing with the European Investment Bank. And then mobilizing and coordinating. This is big. This is across industries, across the economy, across sectors. So coordination is very important. So as we think about these are just ideas for Spain writ large for how to think about how to coordinate a brain economy plan and how to build it. The brain economy, it is strategic simplification for pragmatic change. It is aimed at bridging science, different types of neuroscience, whether it's educational neuroscience, clinical neuroscience, workforce neuroscience, bridging that with public and private power structures. That's what this is about. It is a defense against reductionism because the economy is complex, life is complex. We have all of these exposomes and environmental factors we're exposed to. So it's trying to think about the brain as an asset, and that of course means that it is complex to measure. It's not simple to measure. It's not just looking at TNF alpha in the brain or something like that. It's thinking through systems of neuroscience. But we do think, and we are seeing in the world, that it's an opportunity for novel research, investing, and policy. And I think we'll see that manifest today with many of the speakers. And the brain economy is meant to be reflexive and iterative because, as we know, the economy and society changes very quickly. Since the new US president has come in, we've seen many, many changes in the world, and artificial intelligence is changing almost weekly. So the brain economy tries to adapt and iterate to these things to make sure that we are in the minds of political and business leaders. I share another way to think about advancing the brain economy is for us to focus firstly on knowledge development. This is a shout out to the scientists. We must develop a strong ecosystem for knowledge, insights, and research, and develop frameworks and tools, whether it's changes to Alzheimer's disease research or innovations or exposome research or looking at educational neuroscience. It all should start with knowledge development. Thought leadership and communication is key in the context of Spain as we try to get this known and out there. How do you do things locally in Spain, regionally, provincially, nationally, but then also taking Spain as an example internationally as well, so that you can learn from other people. Mobilizing is key, mobilizing industrial players in the private sector, as I described, different types of companies, internet companies, AI companies, food systems companies, and then cross-sector coordination is key. So these are some of the things that we'll need to think about in Spain as we want to really nail the brain economy plan. We do have a bunch of emerging science linking brains in the economy, and these are all sort of fairly vast manuscripts, but just a couple of weeks ago, there was the state of global air talked about the negative effects of air pollution on the brain, which many of you will be familiar with. It's a wonderful colleague, Borchin Ikiz of ours, that articulated this for the State of Global Air report. So let's think about air pollution management in Spain as well. Let's think about, in the middle ground, the role of neuroscience in One Health. How does neuroscience help us to think through better ways of having planetary health, animal health, human health, reducing microplastics, reducing chemical and toxin exposures, and what is the role of the brain as the seat of our green skills? The green revolution requires invention, innovation. It means people need to have ecological intelligence and green skills to be able to, make the right environmental decisions about their rubbish, about their consumption, and about ultimately engineering better technologies for the future. And then on the right is a wonderful exposome work that a colleague of ours, Agustin Ibanez, is leading, which is published regularly in Nature Medicine these days. And so Simon Fisher-Baum will talk about developing a formalized brain economy research strategy. And Simon first presented this at the UN General Assembly a couple of weeks ago. We now have a manuscript in development, and I hope that this could be a model for Spain to consider as perhaps the first country to look at what could a brain economy research strategy be. So I think about you, Mara, about how this may hopefully be relevant to Spain. And so I hope you enjoy Simon's remarks and we can look at how to develop something unique for Spain. We do have a lot of policy innovation going. David Gow will talk about the Center for Houston's Future Brain Economy Project, which is the first city in the world. We have been working on G7 programming in Canada and now in France, and Powell Swoboda will talk about this. Of course, working in sector-specific contexts on the left, we have been engaging in crisis contexts, in energy, power utility companies. What is the role of brain capital in supporting the workers of power and utility companies? Workers that are exposed to the environment, exposed to risk. How do we ensure that those workers are doing well with their brain health and their skills? Built environment is very important. We have a large coalition under the Building Brains Coalition with design, architecture, real estate companies. Of course, as Spain is home to many UNESCO World Heritage sites, not least is the Sant Pau where RIM is sitting. What can Spain do in the built environment space? Better buildings for our brains. And then maybe one thing I want to mention is region specific. We do have a large drive now in California. The governor of California has challenged us to deliver a California state brain economy plan by around April 1st next year. And so there's a lot of work on that, and it'd be interesting to explore dialogues between California and Spain if that's of interest. So join us. This is my last slide. Join us in global coordination and coherence. And this is a great way that we can dialogue with Spain and keep engaged and keep sharing ideas backwards and forwards. We have just executed a global coordination strategy with the McKinsey Health Institute, High Lantern, Milken, and WEF. And we will likely be launching a Global Brain Economy Institute in Davos in January. And we, of course, have this WEF Brain Economy Action Forum on the right, which Rim mentioned that EMEA is a pathfinder. This is just another mechanism for Spanish organizations to come and interact with us and share with us and learn with us. So I hope this gives you a sense of the brain economy, what it is, where it's up to and where it's going, and hopefully sets the scene for a rich discussion today. Thank you.
Thank you very much, Harris. This also allows us to see where the brain economy is evolving, and I'm very happy to see that all the colleagues are part of this. We're trying really to move into a brain-based economies that really recognizes the value of our brain individually and also collectively as a core asset for our societies and economies to thrive. But also there is also a clear symbiosis between our brains and the nature. This is also something that is so important to keep in mind and to nurture over the years to move into what we call this regenerative thinking. So instead of this extraction thinking, is to moving into regenerative thinking. This is really something that we are working on, to prepare for the COP30 together also with you and with other colleagues who are not with us today. And this really dimension to put the brain not in silo in terms of only health or also skills, but within the planetary, or call it the planetary health and one health condition. And this is also what you mentioned, the work of Ibanez, Agustin Ibanez, that is quite essential in this perspective. And I just also want to say that Harris has different hats. He's a neuroscientist, a psychiatrist, and he has been really quite, I would say, pioneer in this thinking interaction between neuroscience, economics, and policies and business. And since the years that we've been working together, we are moving quite fast. So with this, I would like to invite Mara Dearson Sotos. She's the president of the Spain Brain Council. Mara, she has worked a lot on brain issues too, and then we are very happy to have Mara, also member of Euro-Mediterranean Economists Association Advisory Board. And with Mara, when we met, it was a great connection, because I see that there is so much to be done in Spain, and that we can connect also other countries within the Mediterranean and beyond the Mediterranean. So Mara, the Spanish Brain Plan, and what is your plan, please?
So first of all, thank you so much. It's really exciting to be here And it's amazing to listen to all the initiatives that are being boiled across not only Europe but worldwide. I think it's very important that we start recognizing that our brains are our main assets, right? In every sense. So being a neuroscientist and devoting all my life, all my working life, no, to studying the brain, I really thought that it was very important to take action, right? So what I will present you today is the initiative of the Spanish Brain Plan, and the title was From Vision to Implementation. So I hope you will see the effort we have been making to really bring this into reality. So it has already been said, the numbers are terrible, right? We have almost 50% of the population suffers from some brain disorders. It's, in fact, in Spain, in part because of longevity, is 2% higher than in the rest of Europe. In terms of disability, Rim, you already mentioned, is the leading cause of disability in terms of the neurological diseases, and the second leading cause of death. And of course, with time, with the socio-economic environment, with the geopolitical situation, the things are not getting better, especially for mental health, right? So we have seen in the last year an increased risk in suicide, etc. And in fact, the cost is terrible. I mean, the investment is low, but the real cost, if we take into account, as has been also said, the direct and the indirect costs of brain disorders, it rises into almost 8% of the GDP, right? And this is not only numbers that apply to Spain. So, of course, these figures clearly underscore the need of a national strategy for brain health. And the idea is to integrate, of course, research, fundamental. So science, prevention, early diagnosis, and equitable access to treatment. However, brain health, as has already been said, is not just a medical goal, right? Brain health is our future. Why? Because the World Health Organization defines brain health, no, as the state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains that allows a person to really realize their full potential over the life course, right? Irrespective of the presence or absence of disorder. And this means that we need to work not just in curing what is already wrong, but also in preventing, but also in boosting the brain capacity. And I very much like, and this is a sentence from your paper, Harris. So brain capital can be broadly defined as a form of capital which prioritizes brain skills and brain health. And it has already been mentioned, the brain economy, the real change in the vision, no, of what brain health can bring to the economy, and how this brain capital will fuel this new brain economy. So who has prepared the Spanish Brain Plan? So we launched the Spanish Brain Council kind of 10 years ago almost. However, in the beginning, it was mainly to disseminate science, etc., right? We have been increasing our representativeness, right, and our alliances. And the idea is that we speak with one voice. We have patients, we have scientists, we have industry, we have research foundations, we have economists, we have sociologists, right? So the idea is to, in a holistic way, in an umbrella that really embraces all these different aspects, to promote brain health as a strategic national priority. And we are convinced that this will improve the lives of millions of Spaniards, not only those living with brain diseases, but also to the general population. So we started kind of 2 years ago already, when we had the Spanish presidency of the European Union, right? We started with a Senate, let's say, event, right, in which we brought many stakeholders. Here we have Suzanne Dixon from the European Brain Council. So the European Brain Council was really boosting this event, right? But we had big neuroscientists. We had also people from the general public society and I mean, people that had mental disorders, etc., right? So it was a really enriching event in which I have to say that the politicians were really surprised, not only about the numbers of brain disease that they were not aware at all, but also about the all that is being made through research, right? And how it is impacting really the situation. So we decided to launch the Spanish Brain Plan, and the first thing that we did was put together people from many different patient associations, researchers, and the idea was to really learn together. And we were discussing for more than almost 1 year, and we arrived to different conclusions. So, of course, brain diseases generate high levels of burden on caregivers, high family costs. Most of the cost of care for the patients is assumed by the families. And we don't have a chronicity strategy, for example. But also, we don't know the scope of the problem, at least here in Spain. We don't have censuses or we don't know how many families are affected by the different situations, right? And also, we don't have biorepositories that are useful for research, right? Most of them are not associated with strong clinical informations or data. So it's very difficult to really move forward. Then there is, of course, in Spain and as in many other countries, there is not a homogeneous healthcare model for brain disorders. There are no coordinated programs between different public bodies. We mentioned that also, health, social, educational, administration, etc. Or there is also no national strategies, right? Now we have the mental health strategy or the Alzheimer's strategy, but they are very, let's say, partial. Of course, research in neuroscience is underfunded, and there are no evidence-based standards that are applied, and most neuroscience disciplines are not taught in universities or nor public continuing education to medical professionals. They don't know what brain health is, for example, right? So from there, we define some strategic priorities in terms of healthcare, early diagnosis, continued care, then to overcome the regional inequalities, the access of services is very different across different parts of Spain, and this, of course, is unacceptable, and it leads to inequity, right? Then healthcare resources and prevention are below the standards of comparable countries, and investment in neuroscience is fragmented and scarce, right? So the idea was to have like different access, right? That would help us to really get to 5 strategic aims. We need to increase our knowledge. We need an open data infrastructure on brain health, connecting biobanks, cohorts, neuroimaging, artificial intelligence, clinical registries. We need a person-centered care, right, model that prioritizes prevention. We need to increase research, really, and we need to incorporate brain health into public policies, but not when everything has happened, not from, I don't know, 50 or 60 years and after that. No, 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 no. Since childhood, right? And we need the participation of the society in general, and of course, the patients. And we need to give the patients a voice. We need to promote brain health literacy, combat stigma, etc., right? So we have already started with some actions that I will briefly explain to you. The first thing, we wanted to understand whether, as Rim was mentioning, whether the investment really matches the numbers in terms of brain disorders. And to this aim, we looked at research, right? Brain research and innovation in Spain. And so we have already some initial data. Research in neuroscience is kind of not growing too much, especially basic research is very low, but clinical research has grown in the last years. So this is good news. And if we compare the European funding, that is not the Spanish funding, and unfortunately, I don't have those data yet. But in fact, in neuroscience, in the area of neuroscience, both the number of applications and the funding is higher than in other areas like cancer, right? So the other thing that we wanted was to put numbers, right? So there is a study that was made by Dr. Rafa de la Torre. He's here in the panel. And in this study, we could see that in fact, intervening with multimodal interventions and these paired with some specific, let's say, molecular changes through natural compounds was driving a clear improvement in different aspects of cognitive domains, right? So now we are looking at what would be, because this would be the idea of the brain health services, right? To prevent the development of the cognitive impairment. So this was done in people cognitively with subjective cognitive decline and at risk of Alzheimer's disease. And what we saw is that, in fact, we could really see a change in how things develop. These will have an economic impact, a socioeconomic impact. And we are now launching a study with Weber Foundation to really quantify the socioeconomic impact, because this will make the case for establishing these brain health services, right, in our country. So the idea with the plan is to really create a multi-sectorial governance, or align different ministries, and I will comment briefly on that, to try to really combine this public funding with EU programs. And we are working with Rafa also. We have applied for Horizon Europe with several programs, brain health programs. We need to develop indicators. We need to track the progress. And in this sense, in the Spanish Brain Plan, one of the actions is to create this observatory of brain health, right? Not only in Spain, but also in Portugal. And then, of course, we need to guide the ethical and equitable use of digital and neurotech tools and incorporate AI into predictive modeling, healthcare analysis. This is not just for neuroscience, but in general. But it's especially important for neuroscience because more and more we are moving into this area of the Internet of Things and the e-health tools, adaptation and personalization. So we are already working with different ministries, and I can mention health, science, presidency, justice, territorial policy, equality, digital transformation, youth and children, ecological transition, of course, but also things like urbanism or Ministry of Transport and Sustainable Mobility. So for each of them, what we have done is work on, of course, the specific measures leading to our goals in each of the ministries. And just to put an example of what we were discussing, designing environments that promote brain health, so the brain-friendly cities, for example, right? And there we are also collaborating with RIM. We hope to really boost this initiative and make some pilot studies here in Catalonia. But there are many other things. So all these ministries, we are working with them, providing scientific evidence that supports the measures and the recommendations that we would like to bring on the table to have policy incidents, right? So of course, there are other stakeholders. We also have the participation of the Secretary of State in Health and the General Secretariat of Research, Investigation, and Innovation, right? We are also collaborating with politicians in the Senate of Spain and in the European Parliament, and helping them to define, for example, the Biotech Act for health, right? And also we have the support of the Queen of Spain. So we are really trying to involve most of the stakeholders, but we are also very much engaged with young people. So we have the Young Spanish Brain Council area, and those are high school students that are really helping us. For example, we are now launching a brain health campaign, and we would like them to help us to really shape the messages so that they also resonate to young people. So to finish, I think that the Spanish Brain Plan, it has been a challenge, frankly speaking, but I think it's a look to the future, right? And the idea is that we really need a deeper understanding of how the healthy and diseased brain work. And this will be a foundation for improving early detection, prevention, and development of treatments. But we also need a more comprehensive approach that understands brain health and brain capital as priorities, right, in our society. And let me finish with the sentence, brain makes the world go around. Brain capital drives economic empowerment, social resilience, and emotional connection, and remarkably is not captured by the GDP measures. And thank you for your attention.
Thank you, Mara. This is really quite comprehensive and extensive in a sense that you talked about all the key elements that would drive a brain plan toward a brain economy. And I like very much your slide where you mentioned that you have a multitude of stakeholders in the ministries.
Mm-hmm.
Maybe I didn't see it well because it went a bit fast, but I have not seen the Ministry of Finance. So
yeah, they are also there.
So this is important because who are they willing to pay for this transformation that the brain plan of Spain is proposing in terms of, for example, you mentioned several times prevention. You also mentioned the role of the public sector several times. So, of course, you also said that neuroscience research is underfunded and many other areas of research are underfunded. But, of course, neuroscience is so important. And is it really matching, for example, I don't know, in terms of euros, the funding put aside for cancer, for example, research? Also, you didn't mention anything about the role of the private sector, because nowadays, and also Harris made the parallel with the green transition. Now we are asking in the green transition, the private sector to step in because they are also part of the stakeholders. So I feel that we need to make the same type of thinking. What is the role of the private sector in this transition and transformation? And I agree that we need to track progress and measurement. And this is what also Harris mentioned. I mean, we need to move into more systematic measurement at all levels, because if we're moving into an economy, we also need to measure the key pillars on how to drive the economy. And ending with the quote of George, and absolutely agree. So we are moving into a complete different economic transformation, which is based on probably a complete change of paradigm of what we've been used to hear and listen. So all of this, Mara, how do you see it interplaying in the ecosystem that you are living in here in Spain, particularly also that we are within Spain, and it's a fantastic and very interesting country, and we will see after in the discussion. It's quite diverse, and it is there are different regions that also need to have certain agreements about, the relevance and the importance of this topic. So how do you see this?
So there are many questions, and I could give a second talk. Let me just summarize a little bit. So on the Ministry of Finances, of course, the thing is that what we need, and this goes also into the public-private collaboration, right? And the involvement of the private sector. The problem is we need to change a little bit how the Spanish law considers the investment of the private companies, right? And especially if we want to also be more extensive and have donations, etc., right? So this needs to be improved. And this is one of the things that we are asking to the Ministry of Hacienda, that is not precisely the finances. So for how we finance from the public sector, this has to be worked out with each ministry. So for example, why are we doing this socioeconomic impact study and use the PENSA as a model, right? Because they asked, one of the things that we said is we need secondary prevention, right? And they said, oh, this will be too expensive. So we said, okay, let's do a socioeconomic impact study on this pilot example, right? And tell them how much they will spare if they really invest on those brain health services, right? So what we are trying is to provide evidence so that everything is substantiated by data, right? So that they will not have any argument because what they will invest is much less than what they will spare, right? So as for the other ministries, of course, with each of them, we are providing some recommendations. We have been working on substantiating all the recommendations with this, let's say, evidence, scientific evidence, right? Showing examples. And also we have used many of your data and papers, etc. Right? And for example, for the interterritorial inequalities, that's a very big problem. And, depending on where you live, you will have access to some specific services and or not, right? Neurorehabilitation, for example, is a big problem. Chronicity is also now that we are starting to move into advising the Ministry of Health in the strategy for chronicity that they will launch next year, right? So between this year and next year, we have time with them to really work on it and tell them how they should be organized. And what we asked also in the Spanish Brain Plan, as you said, it's very necessary that we have national strategies, right? Not that each autonomous community works in a different way, with different standards, with no, let's say, concerted strategies. And this is something that we are also working to try to move on. One of the problems of the Spanish Brain Plan, we are like a scientific society, so we don't have much support. And of course, it is mainly based on volunteers, as usually happens in this country for this type of initiatives. So I wanted to say this because it's really the effort of people that are really convinced that brain health is important and should be a priority and should be in the center of everything. And they are really investing a lot of effort and time and and resources to really bring this on the table, no, and make it happen somehow.
Thank you very much, Mara. I think you are completely passionate about this topic, and I am sure within the Spanish ecosystem, the leadership is there, and I am sure you will convince them for more support. Now, let me move now to the panel discussion. We have some distinguished panelists with us. I would like to start already with Marta Sanchez Brett. She is the director of We Mind cluster. So in Catalonia, there is this cluster on brain health, mental health. And we had the chance with Marta to work together within the Catalan ecosystem. And here, Marta, the floor is yours. There is a Spanish brain plan currently, and we even had a webinar at a point in time talking about a Catalan brain plan. So should we really have regional brain plans or having a national brain plan to make sure that these are adaptation or the regional adaptations are all there and there is a kind of learning from the different regions. So how do you see this, Marta? You are muted.
Now?
Now, yes.
You can hear me? Yeah?
Perfect.
Thank you, Rim. So good afternoon, colleagues and friends. A privilege to be here and speak today together in this context of the brain transition economy. So yeah, Catalonia is a hub for mental health and neuroinnovation. And we have for sure strong assets in research, in healthcare and industry. As has been said by Mara as well, we face also in the regions some significant gaps in access to care, mental health support, the integration of innovation across sectors, and from WeMind cluster and the representation of our ecosystems, we are trying to support shaping this Catalonia's brain health economy plan to address these challenges and that you have been explaining from global to national perspective today, and harness as well our strengths for more resilient and inclusive future. Paula, can you please, can I share the presentation?
Yes, sure.
Yeah?
Should I share it or would you share it yourself?
Yes, please. Thank you.
Yes? Okay.
So here we are. So we mine cluster as we are in this process, to fast forward, to advance in innovation and business development in these three areas closely related to brain transition economy. Next, please. So I don't know if, yeah.
We see the same.
Yes. So as said, the mental health and personal autonomy sector in Catalonia employs, according to our latest studies, more than 62,000 employees, grouping more than 772 companies. And in this sector, 82% of these companies are SMEs. The turnover, the global turnover in this region is 9.2 million and is being multiplied by 5 in the last 3 years, because as said, the growing needs of the giving services and products to the demographic growth, to the increase of mental health affections and burden are growing. The turnover, the sector represents this 3.79% of the total Catalan GDP, and being the pharma and the complementary industry the largest, representing this 48% of the total.
Marta, one clarification. You said the turnover is 9 million or billion?
Million in Catalonia. Million.
Okay, that's very small.
Yeah. So the services providers are counting more than 70%. So the majority of the employees are in this sector, 70%. If we can we move forward, please? So WeMind ecosystem, we are focusing in personal autonomy, and we have for this shown data, economic data, we are representing 20% in our own ecosystem, but we do have the public institution, the technical companies, the pharmaceutical firms, the hospital, the research centers, universities, and startups, all day focusing on personal autonomy based on brain health and brain functionality. In this ecosystem, so as said before by Harris, to fast forward and to progress, to advance, we need to work in 4 different verticals, right? So one is knowledge development, the other is leadership and communication, then the resources mobilization, and the work cross sectors. So this is what WeMind cluster we are doing from our ecosystem cross sectors to the rest of the clusters. How do we do that? By strengthening the networks, working in collaboration with public and private funds, and creating shared value projects that promote not only the economic growth, but the best focusing on the best biopsychosocial environment for those who suffer mental health and brain health affections. So this is what we are doing from WeMind to pursue or to support this process to advance on the brain transition economy. Next, please. Moreover, what do we want to pursue? And this is something that's got already been mentioned as well from Mara. You know that in the European Union, the European Strategy for Data from 2020 set out to create common European data spaces in key sectors, including health. The European Health Data Space, which is currently under development, aims to unlock the value of health data for better healthcare delivery, research, and innovation. But yet, brain health data, and specifically brain health data and social data for brain economy transition still remains fragmented, as has been said, and often silos across clinical, research, and social care domains. What we do propose from WeMind cluster is to pursue a common data space for brain economy transition. We do have an advanced intelligent platform, which is called MindSys, and we hope that we can bridge the gap, providing an integrated framework to collect, share, and leverage brain data related in a secure, ethical, and interoperable way. So we would like to, can you please move? We would like to approach MindSys as a support for a common data space for brain economy transition to create a digital ecosystem that promotes this voluntary data sharing in a sovereign trust and security environment. We are fully aligned to these European health data spaces. We would like to promote this innovation in personalized services and solutions. And as expected impact, we would like to position and support brain health as a strategic domain within the European health data space, provide a foundation for brain positive innovation, as has been discussed earlier in this session, accelerating the therapies, the diagnosis, and preventive strategies. Enable as well evidence-based, as Mara was mentioned, policy making by connecting brain health with data socioeconomic indicators and supporting brain health dashboard, and foster trust and collaboration across stakeholders, enhancing Europe's leadership in brain health and brain economy development. So by recognizing the brain capital as a priority, we think that we can unlock this economic potential of the brain and the brain societies. We can improve the quality of life and build a more resilient and inclusive society. So we are, in our humble regional view, trying to help and support these networks and trying to actively participate with these platforms to fully commit to the brain economy transition. So more or less that's why we are here today. Thank you.
Thank you very much, Marta, and thank you for sharing the work that WeMind is doing on MindSys. And I am also very happy to share that EMEA is part of this important project, trying really to share the data that we have developed within the Brain Capital Dashboard project, and trying really to connect this individual data with matching it with macro data.
Exactly.
Data. But also, I'm very happy to hear that there is this collaboration between private and public actors within your cluster. And I think there is a huge potential, as you mentioned, because the mental health and personal care, you mentioned, is 3%, almost 3 point something percent out of GDP of Catalonia.
Of Catalonia, sí.
Found, if my calculations are correct, more than 200 billion. And so mental health and personal care is 3% of that. That's a lot. That's
a lot. And it's been multiplied by 5 the last 3 years that we have been working on that.
Exactly. And I see the evolution isn't going upward, not downward, because of what we have been discussing previously with Mara.
Yes.
Thank you very much, Marta, for your contribution. Now I would like to move to our next panelist, Rafael de la Torre Fornel. He's from the Integrative Pharmacology and System Neuroscience Research Group, PINS. From the Hospital del Mar Research Institute. We had the chance to talk and discuss about new model of care for overall for health and for brain, which is based on lifestyle changes. And this is completely aligned with the MARA call for more prevention, more diagnosis, and more taking our brain as an asset and invest in it at onset from day one. So, Rafael, you heard about the brain plan from Spain, also the movement toward the brain economy globally. And here we are trying to connect different disciplines. So how do you see, what is your view on this? You're muted. Muted, yes.
That's it. Thank you. Good afternoon. Thank you for letting me to participate in this webinar. That is entitled. Sorry about what's. Something.
Yeah, we hear you.
Did you see my screen?
Yes, we do.
Yes.
No.
No, not anymore.
I know. No. But because something was going wrong. That's it.
Now, yes.
Thank you. Yeah. I have I prepare a short presentation on the role of lifestyle change during the life cycle, particularly thinking on the dementia prevention, because in Spain now we have an estimate of 1 million subjects that are affected by dementia, and the prospects are of doubling these figures by in 25 years. And this very challenging. In the next slide, what you have is a kind of summary of the report from the Lancet Standing Commission that periodically reviews which are the factors that contribute to dementia. And in the last report in 2024, their conclusion is that they were able to tackle with about 14 risk factors. We could prevent or delay about 45% of dementia cases, which is very important. If you look at these 14 risk factors, many of them are related to our lifestyle. Then the idea is that we are able to modify some of these risk factors. We should be able to prevent dementia. In practice, what happens is that has been a seminal study that was conducted in Finland, is the finger study, where quite a lot of people, about 1,200 people, over 2 years, they were participating in a multi-domain intervention with components like diet, exercise, cognitive training, and muscular release monitoring. I mean, all of these are components of our lifestyle. And the thing is that these subjects were, of course, at risk of developing dementia by age, which is a non-modified risk factor, and also with this composite score, the CAIDE, which is a composite score of evaluating several cardiovascular factors that are risk factors for developing dementia. The conclusion after 2 years is that the people, not only there was not a cognitive decline observed, but they were even able to maintain or even improve their cognitive function. And this was the first evidence that modifying these lifestyle factors, we were able to tackle with dementia. The IP of this project was Mia Kivipelto, which is a really very nice scientist, very active and pushing. And she was able to convince by that time the Alzheimer Association that in the absence of disease-modifying treatments, this association, which is the largest association funding research around the world, the Alzheimer Association, they have to bet for prevention. And they convinced them that the model of the finger that was initially developed in Finland should be spread around the world. And they create this worldwide fingers network, which is in fact a network of clinical trials ongoing in about 70 countries around the world. And the idea was to replicate the finger study, of course, with some modifications, but taking into account the sociocultural and socioeconomic environments of every country. In Barcelona, in collaboration with the Barcelona Beta Research Institute, my research center conducted one of these multi-domain clinical trials, which is known as PENSA. I'm not going to show you results of this study that was particularly successful. But the idea after over the years is that the multi-domain lifestyle interventions that start early in 2015 in Finland, they have come to stay. And this is something that we have to accept. If we want to do prevention, the best way of doing prevention is tackling with modifiable risk factors that have to do with our lifestyle. The question is which population are candidates for these kind of multi-domain interventions? And here's where it comes some populations that are in the preclinical stages of dementia, and most of these peoples they met criteria of what we know subjective cognitive decline. Subjective cognitive decline is essentially an individual's perception that their memory or other thinking abilities are worsening, but in practice they perform well on cognitive tests. And in fact, they are a risk population of developing Alzheimer. The problem that they have is that our memory clinics or let's say neurology department, they cannot offer nothing to these subjects. And just in Spain, we estimate that we have about 800 subjects that have subjective cognitive decline. This population that is there, but we are not offering nothing, was the candidate population to be, let's say, treated with these multi-domain lifestyle interventions. And this was the basis of the creation of what we call the brain health services. The brain health services that differentiate from the memory clinics that in principle these people are more or less cognitively healthy and don't have symptoms of Alzheimer. They start developing in Europe, and this is a European model where in some countries the brain health services has become part of the of the brain health plans. For example, that would be the case of Scotland and Norway. In other cases, what we have are private or public initiatives of developing these kind of brain health services. That what they try is to provide in some way some kind of care to these subjects that they are not meeting criteria of Alzheimer's disease, but they are at risk of at the end developing it. Everything started in Geneva, in the La Clinique de Mémoire de Geneva, led by an Italian researcher, but he's the head of this memory department, Giovanni Frisoni. And then this concept has been spread around Europe. In Barcelona, we are working in creating a brain health services in Barcelona. But the problem is that, which is the meaning of brain health services? We know that there are a population that are seeking some kind of treatment. We can maybe offer these multi-domain lifestyle interventions, but how it works. Essentially, these brain health services are focused on secondary prevention of dementia, and they do some things that are very important. The first one is they do risk assessment. I mean, they have looking at which are the actual lifestyle habits of persons, some genetic risk factors, some comorbidities, and many others. They're able to establish and perform a risk assessment. I mean, and this risk assessment also has to be communicated, which is not that easy, from not only from ethical perspective, but from even from more practical ones. And then they move from the risk assessment to the risk communication. And depending on the score of your risk assessment, you receive some kind of personalized prevention program, and also follow-up on cognitive enhancement. And as you can see, this personalized prevention is essentially based on these multi-domain lifestyle interventions, following the finger model that you can combine with some pro-cognitive drugs in some cases, depending on the individual's risk. In the middle of this slide, what you have is that people, as you can see, the people without cognitive impairment are the ones that are entering in these mental health services today. If you have a cognitive impairment, you move to the memory clinic. And here, as you can see, there is an evaluation of your style factors and other comorbidities, as I told you, had and everything. You can additionally perform some specific explorations, like PET amyloid or tau PET, or measuring some biomarkers in CSF. But the important thing is that they have developed some tools using artificial intelligence that are able, using all these data, and of course with data from the rest of the population, to establish this risk, the personalized risk of each individual. And following the risk of each individual, you are assigned to some kind of intervention. The model should move, now that we have access to the blood biomarkers of Alzheimer's disease, in addition of acquiring all this data regarding the habits of the subjects and the comorbidities, we can measure these biomarkers, and if they are negative, they are expected not to have further investigation. If it's positive, you can do, or results are borderline, you can participate in additional molecular imaging studies. But again, you finish having a risk score that designs your intervention. In this case, we are expecting that maybe they will be offered also with drug modifying treatments, not only with multi-domain intervention. The movement of the brain health services is growing. They are meeting periodically. The next meeting is going to be in Geneva in February 2026. But which is to conclude a bit my presentation, which is the problem. The problem is that we talk about national plans, but if you talk to Italians, what you can do in the Piedmont or you can do in Sicily has nothing to do, because each region has their own health policy. And the same happens in Spain, that most of the Ministry of Health, in fact, doesn't have much power in deciding how health care is organized in every autonomous region. And we have examples where, for example, in Switzerland, the healthcare is essentially private, while in Spain is essentially public. And the problem is how to implement these ideas. I mean, the idea of these multi-domain intervention style of lifestyle factors that we say that they were come to stay. This concept of brain health service, that means essentially that you are able to estimate the risk of somebody that is in the previous preclinical steps of developing dementia. But how this is going to be structured really in Europe is still something that pending, is in a matter of discussion. Thank you.
Thank you, Rafael. You touched into a very important point, which how to implement those brain health services. So I assume that there is some sort of connection with the social protection policy of a certain country, for example, in Spain.
No.
Or it's not. No. So it's not funded or partly funded by social protection.
These are at present, they are research initiatives.
So at present, okay, so they have to be upscaled within our social protection systems to become, I would say, contributing to the brain
Yeah, the
prevention.
only cases where these brain health services have become part of the national health system is Scotland, Finland, and I know that other Scandinavian countries, Sweden probably is moving, and Norway and Finland are moving to have their own brain health services system, but in the other countries, Italy or Spain or France, no. There are some centers that they say we are a brain health service, but still something that is an ongoing activity how they develop. Yeah.
Thank you, Rafael. I think it would be very interesting to map the existence of those brain health services beyond Europe, also globally, and to see which one of those are or not under the formal official social protection policies. And this will give us as an indicator to what extent there is a prevention effort within each economy or each society for brain disabilities and brain dementia, for example, because, okay, thank you very much. So I would like to Liria Fuentes. Liria, she's the fundraising director at Pascual Maragall Foundation. So a foundation which is totally dedicated to mental issues. Please, the floor is yours.
Thank you. Thank you very much for the invitation. I will share my presentation. A ver. You can see the presentation, right? Okay, thank you. So as I was saying, thank you for the invitation and for including the Pascual Maragall Foundation in this important conversation. As one of the organizations that contributed to the Spanish brain plan, we are proud to see it moving forward. So it's very good to be here today. Much has already been said about brain economy and brain health. I'm not an expert at all, so I would like to focus on how we can make it happen. And I will share 3 messages about the role that philanthropy can play in making this plan a reality. So, first of all, philanthropy is not only about money, it's about building bridges between citizens and science. And philanthropy has always played a crucial role in tackling humanity's biggest challenges, from education and culture to health and climate. And in a context where public funding often struggles to keep pace with scientific progress, scientific philanthropy that may come from individuals, from foundations, or from companies can sustain and accelerate projects with real impact. So it's a way of transforming solidarity into progress by connecting citizens directly with research and innovation. And we're talking about building strategic alliances and bring science closer to society. And I think that we will agree that nowadays this is something that is increasingly essential and also expected in every research project we do today, this connection. And Mara shared a very nice example of young people collaborating. The second message, it's not a message, is the example of the Pascual Maragall Foundation. So we will show how this can work in practice. As well as it was said in the introduction, the Pascual Maragall Foundation, we are a private foundation and we are dedicated to Alzheimer's research prevention. And our model is powered by more than 100,000 citizens across Spain, along with companies and also other foundations that believe in science as a driver of progress. And their support allows us to sustain a long-term research and move faster toward prevention. So since 2013, we have invested 75 million euros and 15 research and 15 million in 2014. So it's through these citizen donations and private partnerships. And we've built this research, thanks to these contributions, we have built a research ecosystem around Alzheimer's prevention And I would like to share 4 specific initiatives as examples of what these contributions are making possible. The first of all is, well, the first one is the Barcelona Beta Brain Research Center, which is our research center with more than 100 researchers dedicated to Alzheimer's disease prevention programs. We also have our grants, the Pascual Maragall Researchers Program, that fund cutting-edge projects and young talent beyond our research center. We have also promoted the Alzheimer's Barcelona Hub, which connects centers and hospitals in Barcelona to foster collaboration. And we also have the Alzheimer's Observatory, which tracks public attitudes towards the disease. And in fact, we are seeing that Alzheimer's is now one of the top health concerns in Spain. And this is especially important because this is a reminder that science must respond to what worries people most. This is already an investment in brain capital, and it is also a replicable model of how citizen philanthropy can sustain research ecosystems. And third, for philanthropy to drive change, it must be treated as an investment and not as charity. So if we look at private funding in Spain, we can see that it relies on 3 main pillars. The first one is individuals who contribute through their donation, fundraising activities, legacies. So it's people like you, like me, people who choose to trust science with their savings, with their stories, their time, and maybe even their inheritance. Then we have also companies which increasingly integrate social impact and sustainability into their business strategies, and they are supporting research that align with their values and ESG goals. And last, we have foundations who bring together knowledge, resources, and partners to make large-scale initiatives possible. But for this ecosystem to work, philanthropy, as I was saying, I will repeat it, philanthropy itself needs investment. So we must stop thinking that efficiency means spending as little as possible, because the real impact requires professional teams, long-term planning, and trust. And it is not about spending less, it is about investing better. And well, just for closing, in the end, this is not only about generosity, it's about shared investment in our collective future. And this is why advancing brain health requires an alliance, as it has already been said, between citizens, companies, foundations, and public institutions. Because when we work together under a common vision, like the Spanish Brain Plan, we can turn goodwill into progress and collaboration into making this lasting impact that we're talking about. And that's it.
Thank you,
by my side.
Lilia, for emphasizing the role of alliances. And I absolutely agree that this is not about spending for just to spend, but it's really more efficient and resilient spending. Thank you very much. So I would like now to with no further ado, to other experiences, quite important experiences, in fact, with David Go. He's the CEO of the Center of Houston's Future. And David, within the CHF, has launched in the fall of 2024 a very important large-scale initiative to position Houston as a global leader in brain health. So things are moving in other parts of the world. And let's hear what David will tell to us. David, the floor is yours.
Great, thank you. Wonderful to be with you all. I've met a few of you, and I look forward to meeting most of you ultimately. So I look forward to that. I will share with you what we're doing in Houston. And when I share the Houston story, the focus is really about Houston, but we really hope to connect with and be part of a global effort. So we are going to do a lot of place-based work locally, but hope to connect globally. And I think I will too share some slides about the work we're doing. Does that display for everyone?
Yes.
Good. Okay, so we are working to capture the full potential of this brain economy, and we're using a lot of the same language that you are, in large part because much of our work is the inspiration of Harris, Of course, he's a fellow at Rice University, the great university that's here in our hometown of Houston. We are launching what we're calling Project Metis. Metis is the Greek goddess of deep thought and wisdom, so we selected her to be the name of the project. And when I share the project with people here, I really have 3 points that I cover. First is this exciting opportunity in neuroscience, an exciting opportunity to really enhance people's brain health, human flourishing, economic growth. We're declaring this the advent of the brain economy. Many of the same messages that you've just been sharing. And then second, why we think Houston and Galveston can be a leader in brain health. Ideally, we will serve as a lighthouse for brain health. And then thirdly, the various steps that we will take to position Houston to lead. So in this first section on opportunity, we're defining the initiative this way, very consistent with the way many of you are defining it, but we define it as a holistic initiative. While we're focused on the brain, we recognize the interrelated nature of brain health matters, the brain-gut connection, the brain-heart connection. So it's holistic, focused on lifelong brain health, the full life cycle of the brain, to spur economic growth and, of course, enhance human flourishing. And when we share the initiative, we point out that it really requires a little bit of a different mindset. We're calling this a from and a to, where we've been and where we hope to go. And so in the medical arena, here in Houston at least, there's been a whole lot of attention for heart health and cancer care. We think now is the time to focus on brain health. We've been measuring physical health with devices. Now we can measure brain health. And then when we talk to corporations, and we are bringing the private sector corporations into our initiative, we recognize that many of them think of health, mental health as a cost. We want them to think of brain health as an asset. Many of them are investing in intellectual property or AI capabilities. We would like to encourage them to foster and develop and invest in brain capital. And then lastly, of course, the economic headlines right now are all focused on AI. We don't want to compete with AI. We think of AI as a complement to our efforts, but we think it's very important to have a focus on the brain and brain capital, and that the brain can unleash lots of economic growth. We argue the time is now because there are both issues to address and opportunities to chase. This group, of course, is very familiar with all of the issues to address. And I've heard really compelling stories here today about mental health. And then AI certainly changes the dynamic here with the brain. And then the opportunities to chase are equally strong. So with a need to do it and opportunity to chase, we're arguing that the time is now. The neuroscience breakthroughs, the new measurements, this is the moment we can really invest and develop in the brain. That premise is backed by the large amount of investor dollars that is being poured into neuroscience. And these are some of the most sophisticated investors in the world. Kleiner Perkins and Sequoia and Google, blue chip venture capitalists. And then, of course, some very, very wealthy individuals who are pouring capital into neuroscience. And the kinds of investments they're making are companies, I won't go through all the companies, but just look at the bolded words. They're addressing things like paralysis, cognitive decline, depression, anxiety, and addiction. And then on this next slide, 4 more: dementia, monitoring the brain, Parkinson's, and mental health support. So all this capital is coming in because the time is ripe and there are many innovations to capture. We too thought about the economic side of this. So yes, human flourishing, but also we're looking at the same sort of discussion around economic growth. It starts with a healthy brain. You add skills to health and you have brain capital. And then, of course, the marketplace of brain capital unleashes the brain economy. And then many of you would be familiar with McKinsey's work that suggested if we could unleash the full productivity of a brain through a full life cycle, there's tremendous GDP economic upside. And so the summary of this first section is we're very excited about the opportunity. We think it includes margin and mission, a different mindset, but the time is now. And that's being validated by lots of the investment that's coming into the space. So yes, we are strongly arguing this is the advent of the brain economy. And then we do believe that Houston and Galveston has an opportunity to be a lighthouse for brain health. And that starts with our great institutions. We've got wonderful neurological institutions, generally associated with our academic and medical institutions. So this is a list of 6 here. We've got another 6 here. And then other attributes we have that I think will be relevant is the Texas Medical Center, which is an umbrella organization for all the medical institutions. And they have some really great innovation hubs, some space and location that will be helpful as we try to co-locate neuroscience startups. We've got wonderful academic institutions. We do have some neuro startups here, lots of large corporations that we hope to engage in this initiative, and we have some already in board. We have a long history of medical innovation here, and we have some community needs. And so for all these reasons, we think we're well positioned to really work hard at this. And then on top of it, as you may be familiar, here in the state of Texas, in fact, on Tuesday, next week, there'll be a vote, and it looks like it will pass, but it will allocate $3 billion of funding for dementia research and prevention. And so this is a really exciting opportunity, and I think it will be catalytic to all the things we hope to do with brain health. And so the summary of this section is simply to say that we think we have the right institutions in place. Our corporations will be supportive and helpful. Our innovative DNA and the state funding, ideally, we can line them all up to be a lighthouse for brain health. And then lastly, the question, of course, is, well, how do we do it? How do we organize our work so we can get this kind of impact, so we can make the transition that Harris just mentioned from ideas to activation? This is the organization that I run. I'm the CEO of the Center for Houston's Future. And the center has been around for about 25 years. We're somewhat of a think tank that works on long-range questions for the region. One of the things we did about 5 or 6 years ago is we really started working hard on energy transition. And with, as many of you know, Houston has a long history in oil and gas. And so the initiative and the work has been to transition Houston from being an oil and gas capital to the energy capital. And it was this initiative, the Houston Energy Transition Initiative, that helped Houston transition to be a global leader in energy. We think this initiative that has been in place for energy for the last 4 years serves as a strong analogy of what we can do here to position Houston to be a global leader in brain health. And so we've looked at what this work has been, what the Houston Energy Transition Initiative has done, and we see a whole blueprint, a roadmap of actions we hope to take. So what this offers here is the kinds of steps and actions that the Houston Energy Transition Initiative took relative to energy, and then the analogous steps, the similar steps that we will take in our effort focused on brain health. So the kinds of things that we will do following this blueprint, this roadmap, is we will bring together leading medical institutions, leading corporate entities. We're going to form some working teams around specific topics. We're going to have some events and workshops that both activate and educate around brain health. We're going to incubate new innovations. We're going to set up an innovation hub that co-locates neuroscience startups. Over in energy, we have a really large innovation hub called Greentown Labs, and it houses 300 startups that are focused on new fuels that are low carbon emission, climate tech, etc. We hope to have a similar initiative and opportunity to co-locate and foster the growth of smaller stage companies in neuroscience. We're recruiting VCs and private equity firms to back those neuroscience entities. We will think about a roadmap of quick wins and long-term opportunities. We'll do some strategic prioritization. And then additional steps on this slide include being a voice for public policy. As the money that comes from the state gets deployed, I think our entity can be helpful in where those dollars go. We want to connect to national and global efforts, connect to the efforts happening with all of you. We are recruiting companies to Houston. We want to comprehend what we're calling brain health equity. The intent here is not brain health for the few, but brain health for our population. And so we're going to take some steps to think about health equity. Talent and workforce, we're working to ensure that we have the skills and we upskill the workplace to achieve our objectives. And then we'll execute a sweeping amount of communications to highlight the work that we're doing, build visibility. So the way that we're organizing our effort is the center will be the convening body, the project manager of the effort. We've found actually 3 leads or faces of the effort, project chairs. And then we've been bringing in people who would be part of a steering team that would meet quarterly and steer the efforts. But most of our work will happen at working teams. We're going to take this big opportunity and divide it into different working teams with focused conversations around specific opportunities. And I'll share with you a straw man of the working teams. So the working teams right now, and this is just a draft, it needs to be approved by the steering team, by the leaders of the effort. But the working teams, as a draft right now, we have 3 teams that are delineated by where you are in your lifespan. So we have an early life team, a workplace years team, and then a healthy aging team. And then 2 teams that transcend where you are in life, science and medical, all the best finding science research we want to embed into our work. And then innovation and commercialization. So this is when we do co-locate new startups, new technologies, new opportunities for growth, new solutions, we want to co-locate them, foster their growth, recruit talent, recruit capital, and ideally help them commercialize and scale for impact. There may be 2 other teams that people are keep talking to us about, is adding a team on determining the best tools for measuring brain health. And another team could be focused on addiction and its impact on the brain. But as we think about these teams and measurement, well, I'll say this. On some of these teams, there's already a lot of interest and trajectory on the work. So for instance, BP is a partner with us. They're joining the workplace years team. And the work there will be to define, what does a brain-friendly workplace look like? What's the built environment there? What are the rhythms of work, the culture? How do we design workplaces and our work lives so that it supports our brain health? And we may come up with a checklist, a certification for companies that have an attractive brain-friendly workplace. And of course, we hope to have measurement tools that would track brain capital at a company over time. So that's one sort of set of work that would come out of the workplace years. Yes.
David, please, because since we are a bit short of time now, this is all fantastic. Really, it's all great details on the blueprint and how the working teams are working. If you could share with us those slides to the group, and then probably what I propose this is such an interesting, you know, I would say content that probably could help the substantiation, in fact, of the brain plan of Spain. So yeah, I mean, if you could conclude, please, that would be fantastic. So we can move to the next two
You bet.
speakers.
No, I'm sorry to have been long, but in sum, we're going to ideally create a community-wide brain health index. We think having an ability to track will have its own benefits. And so we will do some tracking, and we will create a place-based initiative that will ideally come up with some great local solutions, designs, and actions that interfaces with everybody globally. And ideally, we'll be able to get to some wonderful, wonderful outcomes, both at corporations and in communities.
Thank you very much, David.
Yeah.
We will keep listening and following up on what you guys are doing within this dialogue. And I would like to move right away to Simon Fisher-Baum, who is Associate Professor of Psychological Science at the Rice University. Simon, please, I am sorry, but you need to keep your comments short to the point so we can move to Pavel, and then we have to close sharp at 5. Thank
I
you.
completely understand, and I'm doing it without slides, and so I will be able to go a little bit faster. So hi, I'm Simon Fisher-Baum. I'm continuing the Houston thread of this. I'm at Rice University. So a little bit of background about me. I'm a cognitive scientist and neuroscientist who works both on brain skills. So I study literacy and also brain health. I study stroke and recovery from brain injury. As Harris mentioned, I'm also co-leading the Brain and Society initiative that just launched as a part of the Rice Brain Institute. And also for the context of this discussion, I've been seconded from Rice for a couple of years to work in the federal government to oversee federal funding research through the National Science Foundation. Harris put out a bunch of promissory notes about my role on the panel early on, and I hope I can live up to them. But mostly I think my role here is to think about how research about the brain economy fits into this the Spanish brain plan. I think there was totally excellent research that's going to be done, but as you could see from the sort of tension between Rim and Mara, there's a difference between thinking about this as an economic issue and thinking about this as a neuroscientific issue. And one of the sort of ways that I want to talk today is to think about how to bridge that gap. So I'm a neuroscientist, so I'm going to frame it out from the perspective of neuroscience, which are some of our strengths as a scientific community, and let's say where some of the opportunities are for connecting the brain economy to research that's at the core of this Spanish brain plan. So on the strength side, the good news is there's a ton of excellent neuroscience research around the world and a ton of truly excellent neuroscience research that's happening in Spain. The Society for Neuroscience is the world's largest academic meeting. New technologies are being developed all the time that allow for better measurements of brains in motion. Richer theories are being developed about how the brain skills are emerging from patterns of brain activity and how to make sense of the patterns of diseases and disorders we see in the brain. So there's just this incredible thrust of research. The other good news is there's a bunch of great ideas that are around. As we increase our understanding of the wide variety of factors that impact brain health, from environmental factors, nutrition, the built environment, aspects of the workplace, aspects of the social fabric, we have all sorts of ideas about how we might do things to improve brain health. And so there's plenty of research to do to think about how to best intervene. But the scientific community is not quite there to think about how to advance research with respect to brain economy. Research has largely been focused on a few models of impact. So for the most part, a clinical model of identifying and treating individuals who have diseases and disorders of the brain. Even in the talks today, we see that there's been a shift to we can identify that this group of people are likely going to get diseases and disorders of the brain, as opposed to something that works for everybody. But there might be ways to think about social structure and sort of systems to be able to impact brain health for everyone. As neuroscientists, our strengths are not in thinking about questions of scalability. Again, this has come up in some of the tensions of this conversation. We are more used to approaches that assume that if an observation is true in a fruit fly, it should probably be true for all humans than we are in thinking about how culture and context might influence brain health and brain skills. And so these are all things that our research could really rise to the occasion to achieve. So when thinking about research strategy for the brain economy, I asked myself, how can these concepts help us organize a more unified, impact-driven approach to neuroscience research? And also, what kind of science is missing that prevents us from accomplishing these goals? And so the first scientific problem that I think we can tackle to make brain economy research is a problem that neuroscientists work on all the time, which is measurement. So a simple model of the brain economy is that there are certain brain skills, decision-making, emotion regulation, language, resilience, lots and lots of other things that are highly valued and that we worry about being lost in diseases and disorders of the brain. And a big question for neuroscience has been, how do we measure these skills? And I say a challenge for us in the future is, how do we measure these skills not just in the lab, but in the real world, in real complex behaviors that are personally relevant in environments that matter, in the workplace, and in an educational setting. As brain economy goes worldwide, and as has been brought up across all the different regions within even a given country, we need to consider how to do measurements in ways that are sensitive to different cultural contexts. And there's plenty of research that could be brought in to be able to accomplish that. The second scientific problem is modeling. So part of the problem is that we need models for figuring out how strongly our different brain skills constructs are going to map onto something global like our unified measure of brain health. But I think more importantly, neuroscientists tend to think on an individual level, while the brain economy requires thinking at a macro approach. So we need ways to link between scales. And modeling approaches are needed to make this link. And so people keep on coming back to climate and energy as sort of a metaphor for thinking about the research that we're doing here. And I think that's true again in this case. So climate models, but for brain health. We know a lot of factors contribute to changes in the climate. And we know that there's a lot of complex interactions that get us to statements like, we think that the temperature is going to increase by this many degrees over the next period of time. Models provide a mean to make predictions about those things, and brain economy research has to develop frameworks like that, where we think about brain skills at an individual level, interacting with communities, interacting at a more macro scale, and what those interactions mean for what a brain economy measure might look like. And then the third part is intervention, and this is where we have a ton of ideas: neurotech, pharma, nutrition, built environment, all sorts of things. But we need to come up with ways to evaluate whether these interventions, against each other. So we need to use measurement and modeling to be able to think about the effectiveness and cost of each kind of interventions, about opportunity costs, about obstacles to adoptions, so we can develop the evidence that we need to drive the recommendations for the kind of social and policy change that we want. And then I'll just end by saying that we've just launched this new Brain Institute at Rice. And so part of the goal is not just to talk about the kind of research strategy we would do, but actually to do it. So the Brain Institute has 3 pillars. One's a fairly traditional group of cellular molecular neuroscientists focused on understanding brain structure and function and how those relates to disease. Another builds on Rice's really strong neuroengineering initiative, which has already spun out some of the neurotech companies that David Gao talked about. But the one that I think is the most innovative, and maybe it's because Harris and I are leading it, is the Brain and Society initiative, which is really focused on how do we explore the multiple pathways that we can go from neuroscience discovery to societal impact. And the structure of that is to have really strong social, cognitive, and affective neuroscientists who are really interested in how we measure brain skills, paired with people who study humans in the context of their actual lives, paired with Rice's strengths in policy and policy evaluation, so that we can really put together the pieces that we need. And so this is now a promissory note because we're just started it yesterday, but stay tuned to the kind of work that we're doing, and we'll hope to see that we can actually have the kinds of research impact that we want to have. And thanks so much.
Thank you, Simon, for respecting the time. And I think what your initiative, Brain and Society, is really impressive. I think hopefully with this you can lead the way globally. And of course, since we've been working with Harris for years now on trying to mainstream the brain within our societies and economy, would be very happy to continue collaboration on this interdisciplinarity, I would say, movement. But then at the same time, you mentioned that brain skills, measurements and modeling. Yes, please do, because we are missing hugely this component, this pillar. And it is important to develop it, I would say, and the development should be embedded in neuroscience. And this is what I really, really recommend, particularly for the skills that are not connected, or say, for example, emotional intelligence, creative thinking, resilience, and all of these. These are all part of the capacity of our brain, and these are embedded in neuroscience, and that's why we should keep it like this. So I need to go fast since my colleagues are telling me that I'm completely out of time. I would like to introduce Pavel Sviboda. He is the founder of Neurocentury, co-founder of the Brain Capital Alliance, and also member of the advisory board of EMEA. So Pavel, you've seen where we are. I mean, I think there are two very important initiatives in Houston and Spain. How do you see all of this? And please, I will even let you to conclude this webinar. So please do it.
Brilliant. Thank you very much, Rim. I hope you can see my few slides. I will sprint. Do you see them?
Yes, perfect.
Very good. Okay, I will sprint through this material. First of all, what I wanted to say is that we are moving very fast into a new generation type of brain plan. And it's important to realize, because only a few years ago, we were still dealing with relatively fragmented approach of treating neurological, psychiatric, cognitive conditions separately. Then we moved to the brain health concept, and it's only really in 2022, so 3 years ago, that WHO came up with this flagship paper defining brain health and promoting brain health as a unitary concept. And Mara quoted this definitions. I don't have to do that. But we are somewhere else today. We are now realizing that there is much more beyond brain health that has an impact on how we function and how the brain functions, and we need to bring all those influences in to make sure that the brain positive transition objectives are achieved. So you could actually define brain economy in an analogous way to brain health. And you could say that what it really represents is an equilibrium across different domains that maximizes collective human potential. So that's really taking the WHO definition of brain health and applying it to the field of the brain economy. I see the brain plan approach through 3 pillars. One is human flourishing and productivity. That's the economist in me speaking here, with respect to the last item. But I think it's really essential to position this agenda firmly where it belongs in facing today's challenges. And it's interesting that many of the speakers before me have referred to human flourishing already. So that brings out the positive agenda in what we are speaking about. And here are just 2 examples for the sake of brevity. I think we do need to define brain-friendly workplace. I'm glad, David, that you also use that same term. But we need to be more specific about this, right, than we have been to date. And you're working on it, and we are working on it as well. So I call it a blueprint, because we need something that really brings together these individual cognitive and behavioral pathways and the level of the company, of firm. There is this B Corp movement, which is interesting. It's mostly focused on environmental and climate characteristics, and people get certified as B corporations. I think we need a similar type of approach to certify, brain-friendly corporations as well. And with respect to brain skills, we also need to define better the curricula that would enable companies to prepare the workforce for what is coming, and with the emphasis on the cognitive, emotional, creative, and social skills that brain skills, the concept of brain skills implies. Now, the second pillar is the pivot to prevention, and that also has been a current throughout today's discussion. What I would put emphasis on is the need to aggregate the knowledge about modifiable risk factors, because it is phenomenal how much we have learned in the past years about modifiable risk factors. Now we need to look at this in a more holistic fashion to allow for risk stratification and to allow for quantification of brain health in a personalized fashion. And the third pillar, to me, really relates to the fact that there is that accelerated rise of technology in parallel, and everything that we do on the brain needs to relate to it as well. So that's the concept of hybrid intelligence, ensuring that there is as much complementarity between the brain and the machine. That also has to be designed. It cannot be happening by default. Spain has its own strengths, and the one that I look very closely at is in neurotechnology. The Spanish, I think, in neurotech ecosystem has to be brought into the efforts in Europe and globally to make neurotechnology one of the fundamental pillars of the brain economy, right? Because neurotech, after all, addresses what other approaches cannot address. That's why it's there. Pharmacological approaches cannot solve all health-related issues. Neurotech needs to figure in that equation. And then, since we have already seen throughout today that there are these impressive hubs in Barcelona, in Madrid, in other Spanish cities, the National Neurotech Center is also an example of hub-like mobilization. And then we heard from David about the impressive efforts in Houston and Simon. Now, I think there is a case to be made for a hub of hubs approach, by means of which there will be more mutual learning. There will be more mutual scaling also where needed, because not all of the hubs will be able to do everything by themselves. And the last point that I would really like to make in this blizzard-like presentation, given the timing constraints, is on investment. There was actually 2 days ago a very important meeting in Brussels between the European Commission and some private investors to form the Scale Up Europe Fund. It's extremely meaningful that Europe is moving into addressing that scaling issue that it has faced. And actually, out of 8 people in the room, 2 were Spanish, representing Spanish financial institutions. Spain has a robust banking system. It's pretty good and in early adoption of green finance and ESG frameworks. So I would really look to Spain to also be very active in defining brain economy as an investment proposition, and to contribute to our ongoing debate on brainless investing. And here you can see the consultation paper that EMEA's website carries, and we would obviously be very grateful for everyone to contribute. And my very last point is about G7 and the European Brain Economy Summit. So G7 is an important platform because a lot of efforts need to be global. And G7 is, touch wood, of course, one of the remaining multilateral platforms that still function and deliver. It has delivered in the area of the brain before. That's the Dementia Summit of G8 at the time. when the UK had the presidency in 2014. The Dementia Discovery Fund grew out of it. I think we need to convince the French presidency that it also needs to embark on a brain initiative. We are actually feeding in a few ideas. One is to create a G7 brain trust that is based on developmental banks, which are very strong in Europe. The EIB, European Investment Bank, is the largest multilateral actor here. But France has a very strong and powerful developmental bank. The Spanish one is here on the graph as well. It's a slightly smaller circle, but nevertheless, it does exist. So the idea of a brain trust would do a lot to scale investing in the brain economy, which is fundamentally important because we have a huge funding gap and we have huge opportunities which are to be addressed right now. So I hope we can go through all that progress in May 2025 at the European Brain Economy Summit, and then in New York in September at the Global Brain Economy Summit. Thank you so much, Rim.
Thank you very much, Pavel, for a very nice overview and also conclusion at the same time. So I don't want to hold you much more. I just want to give the floor to Mara because this is all this input. It's really to see how the brain plan for Spain will move from strategy, ambition to action. I think there are all the recipes and the pillars for it to happen. Of course, a lot of work is needed, but please, Mara, I leave you to see how all these elements interact with your vision leadership to make the Spanish brain plan from vision to reality.
Thank you so much, Rim. It has been really inspiring, I have to say. I'm very happy to also see that many of the steps that we are taking are also shared by many of you. And many of the things that I didn't have time to comment came up later on. I certainly need to talk to many of you because I mean, the good thing that we have is that our communication with the ministries is very straightforward, is there already, right? And also with at the local level, we are starting to also develop these communication channels. So what I'd like to say is that in fact, this type of webinars, and thank you, Rim, for organizing this, right? Because it's really useful. It's really what will make us, through collaboration, through inspiration of other initiatives, to move forward. And we certainly need to act locally, but we need to permeate globally, right? So thank you very, very much. And hope to be in contact very soon with all of you again.
So thank you, all of you. That was really not only a pleasure, but was extremely inspiring that Mara mentioned. We will continue working from our perspective, also trying to mainstream brain into economy. Of course, little actions from different stakeholders at the end will make a huge difference. So we are all committed within this transformation or transformational journey. And obviously, hopefully, won't be wishful thinking. It will be action on the ground. So thank you very, very much, all of you. We will continue the conversation. Bye-bye.
Bye-bye. Ciao.
Thank you. Bye.